there has to be a plan before you're just collecting data, especially when you're collecting it with communities who have been over surveyed and over analyzed. Number one, we already know what the problem is. So why are we asking the same question? We already know what the issues are. So what question can we ask to get the answer that we really need? How can we support each other in asking different questions so we can get what we need to get the support? And so, I've seen it from the other side, and I understand, like, from a grant perspective, I understand, like, I've had to fill out those grants, and I've had to account for every dollar, for every person, and every resource. And so I get it. I get why data matters and why you have to, allocate for that. I understand.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Corinna Kelley. Corinna is founder and CEO of C.R.E.I.D Consulting, LLC. She guides social innovation initiatives from visioning and strategy development through execution and evaluation to support economic resilience, inclusive and equitable development. With nearly 2 decades of on-the-job experience working as a public health consultant for health systems, nonprofits, health departments, and the Department of Defense, she's conferred a Bachelors of Applied Science in Public Health at the American Military University, then a Master's of Public Health in Health Services Administration at the University of Arizona. In today's episode, you'll hear and learn more about insights from a public health consultant with nearly 20 years of experience, how confidence is a continuous journey and not a destination, the importance of building resilience during life changes and cultivating resilience as a continuous practice, why data needs to have purpose and action behind it to make it meaningful, how networking can open up doors, and that strategic job searching can alleviate your anxiety, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey everyone, I'm Corinna Kelley, community health strategist and transformation coach, and you are listening to Public Health Careers.
Corinna, welcome to the show.
Yeah, thank you for having me.
It truly is
my meet for a while, so it's nice to finally connect.
It truly is my pleasure, and I know how public health professionals are working really hard. It's hard to get time on their calendar sometimes, so I'm really glad that we did find time to chat. I'm looking forward to hearing more about your experiences and your career journey.
Yes, definitely. It's been a long time, so I was actually going through some of my old stuff today since Public Health Week, and I was like, wow, it just hit. I'm getting close to 20 years in public health, so it's been a long time, a long journey.
Well, I'm glad that you're able to reflect on that moment and share that with us. And I guess before we jump into more of that, tell us, how do you identify and a little about your personal background?
Yeah, no, definitely. I identify as she, her. I am half Black, half Latina, from San Antonio, Texas. Born and raised in Texas, but moved around a lot. I am a military veteran, so joined straight out of high school at 19 years old and traveled around to various places, and am settled currently in Tampa, Florida.
Okay. How's Tampa doing right now?
Right now it's good. We're not in hurricane season. We're doing good. The weather's nice. It's beautiful outside. So lucky for this.
Yeah, love it. I lived in Tampa for 4.5 years. That's where I did my undergrad. So
nice.
Very, very fond memories. But the last time I went to Tampa, it changed so much from the time that I went to school there. It's amazing to see the development that's happened.
Oh yeah, definitely growing. We're getting a lot of great things. I was just at the NCAA Women's Championships here, so it was we're getting some really great things. So it's nice.
How has your identity of being Black and Latina shown up in your public health work?
Oh, I think it shows up in everything. I think the reason why I've stuck in the community health space is because I'm Black and Latina, and a lot of the work that I do is really geared to those that look like me. And a lot of the time I'm hired because of representation. So either to do focus groups or, to understand what communities are experiencing. And so, individuals will hire me as a consultant to come out into these communities. And I like it as well because I do get to give that perspective to healthcare leaders, and because I know both sides of it, right? So I've been in the community and living in the space, and then I've also worked in public health for so long. And so I kind of, understand. So even talking to family members now who still have that kind of like mistrust of the, healthcare system, I can kind of, be able to help them navigate and understand a little bit more, being on, on the side.
Yeah, I appreciate that, and I think like bridging the gap and like being. I was just on the call before this. I was talking to someone who was saying like we really have to do some work to make public health cool, and I think like we all have a part in sharing like the coolness of public health and
Yeah.
in doing the work that we're doing. So appreciate you sharing that, and considering that you shared that you've been doing this work for around 20 years, 2 decades. Going to jump into some of the expertise that you have and some questions around that before jumping into how you got started in public health in the first place.
Yeah.
So just to start us off, you have emphasized cultivating resilience and inclusivity in communities. What are some of the unique challenges you've encountered in achieving this, especially across sectors with different priorities?
And achieving like resilience and like more in the professional field or more personal?
In the professional field, and yeah, cultivating resilience more so.
Resilience. Well, definitely. I mean, looking at what's going on right now, currently in our situation, and going through change, and even through, going through COVID, I think what resonated with me, especially just coming out of the military background, coming from so much change. We're so used to adapting and change. We're used to low resources and having to be undermanned and be understaffed and be remote and having to move around. So coming into the civilian sector and, public health, and then having, seeing the challenges, because public health field maybe hasn't been as prepared. Where the military, that's all we do is prepare for everything. And so kind of seeing those challenges, I felt like I was in a space where I did have that resilience and I was able to support different agencies during those times. I actually worked in the healthcare system during COVID. So going through change from, seeing patients to closing the doors, and now we're seeing them in the car. We can't see them directly, mask, and everything is shifting and changing. So helping them adapt during that time, I think I do very well at that adapting. But I have not always done very well at adapting. But I think in the professional field, it's easier for me to shift and think strategically once I find my balance. But that has taken time. And I think it's taken time. I've hit bricks, I've hit walls, and I've had to build that. And I think what's important for people to know is that, you have to, like, resilience is something that you just, I'm good. I took a class, or, I understand what I need and I feel good now. I've taken a couple breaths. It's not just about, one time, situation. It's always maintaining the level of balance, and you'll fall, and then you'll have different periods of your life where you'll be, more resilient than others. And those are learning lessons and learning times. So I think, professionally, actually just recently, I had an experience professionally where I froze. All of the stress got to me. It was everything that we're going through right now. And I was in a presentation, and I was dealing with situation with my child. And I was getting ready for this huge presentation at over 200 people that were going to show up live. And my mind and my mouth was just not moving the same way. And I panicked. And instead of, I wasn't able to speak, I wasn't able to ask for help. I just panicked and that froze in that moment. But I think how I was able to bounce back was, able to explaining that to my client and to the people I was working with that, I had a moment that, a human moment where things were overwhelming and things were, a stress level, and I'm human and I can't overcome everything. And when stress gets to you and you have those moments. And so they still allowed me to continue on. So, we have those opportunities.
Greatly appreciate the vulnerability so early on into the conversation. I think it definitely helps people to understand, like, we all have these moments and times that things happen. And I think to your point earlier, like, resilience isn't just a one moment thing. There's a practice of resilience. It's something that you're always evolving and leading and iterating in your life. And you don't have to answer this question, but feel free to, if you feel inclined to. Maybe what are some things that you would have told yourself? Okay, let's say you knew that you were going to have a moment where you were not at your best in a professional setting.
Mhm.
Maybe what could you have done a week, months leading up to that to maybe like alleviate that or reduce the chances of that, looking on that?
One thing I've learned about myself, and this has definitely taken time, and I think what mindfulness, which is a big part of, resilience too. One big pillar of resilience is, I think, is self-awareness, and understanding who you are, and that is being extremely vulnerable, and that's hard, and it takes a lot of time, and it's like, well, how do you not know who you are? It's like, right, I'm with myself all the time, but it's the little parts of you that you overlook. And one of mine is, because I've always done things by myself. I'm the generation that's was locked at home, in first, second grade, and was able to come home with the key. My parents were divorced when I was 2 years old, so I was moving around a lot. Was always a new kid. I kind of always relied on myself. Well, how does that transition into life? It transitions the same way. So kind of always, being reliant on myself in my work or in my personal life makes it very, very hard to ask for help. And I didn't put two and two together of why I struggled, and why I was having, difficulties in just, simple things. But that was one of the reasons why I ran into a wall recently, was because I didn't ask for help. And being able to recognize and to stop and have that reflection and that self-awareness of, wow, okay, I'm still struggling with this. This is still something that, occurs from time to time, is that I still have a hard time knowing and asking for help at the right moment. So during those times is, high stress, high tempos, where I think I can take on the world because I'm Superwoman. Why not? To stop and to kind of ask for help, and then ask what kind of help that I need, what specific help I need. I think I'm also the type of person that's like, well, I do it myself because I like it done a certain way. Well, what can I live with? And I think that's another part of myself that I've learned, over that self-awareness part.
Appreciate that. And yeah, I think self-awareness is probably like one of the biggest superpowers that you can have. And then another superpower that you could have is like asking for help when you need help.
Mhm.
So definitely appreciate you lifting that up.
Yeah.
Um, so a lot of your work focuses on ensuring that there's fairness and representation for all. What are some practical steps that organizations can take to genuinely support those values?
I think where it really starts, and I get this question a lot. It's like, how do we? I sit at the table, and it's, I've done it from different steps. So I've seen it from grassroots, where I was out in the community and supporting one-on-one. This is with communities that are underserved, and then I've seen it at the level of like management, and then now I'm looking at it from the senior management level, where I'm giving them the data, I'm presenting the information, and trying to hey, these are the strategies. This is how we strategize. These are the partners you want to bring in. Like, let's look at this, strategically. And from all these levels, I've gotten the same type of question. And I think, got to start from it. I think they're thinking, too deep a lot of the time. We're trying to solve something that's, deeply rooted. But we don't start with just basic questions as far as, what do we need just as a basic human right, as a basic human, what things that can we do with what we have. What I like to think about is strengths. What are the strengths already existing in the community? We're always trying to create something new, but there's already stuff that exists in the community where people are and how they are thriving. And that's what people don't understand. And I give an example, for my Nana, who's, very into faith, and, her faith is where she found her resilience and how she was able to overcome. And so that was already existed in her community, that church and that she relies on and that she goes to as her sanctuary. And it's like, that already exists. So what can we do to build on that? How can we continue to support those efforts that are already being done? And I think that's the type of movement a lot of these organizations need to do. First and foremost is focus on the strengths. And then the second one is the duplication of efforts. I see so many, in communities where we work is get the funding and then it's everybody's doing the same type of work, but where can we work together? Where can we all come to the table? A lot of the time I'm communicating and pulling people into the table for the first time. And these, individuals work in the community together all the time. So where can you start those conversations and share that funding, especially now? I mean, where funding is going to be scarce. So where can you start sharing that funding and looking to who does what and how can we balance some of that work? Stop looking at it as a competition and look at it as a partnership and a collaboration.
Yeah, I was just gonna say that, like, everything you're sharing there is undergirding like the importance of collaborating and
Mm-hmm.
like having spaces to talk about what we're doing, where there's overlap, where we don't need to be doing the same things, where organizations have strengths and maybe like other areas for opportunities, and really playing into those strengths. And yeah, more now than ever, I think we are seeing the importance of that when resources are, just not showing up in the same ways and mightn't show up in the same ways in the health space for a while.
Yeah, definitely.
So you've also conducted extensive data collection and analysis for community assessments. Can you share a moment when data insights reshaped the strategy or led to an unexpected outcome?
Data is not my friend. I do not like data. I know data, it's like a love-hate relationship. I remember going into the state health department and meeting EPIs, for the first time, and it was just they were into this data, and the way they could manipulate it was amazing. But that is totally not me. But I definitely value how they can, utilize data to help. And I forget what you were asking me about the question because data is like to me.
No, I love it. I love it.
Have to. I have to use it. But what I think one thing I think that kills me I hear data, is I feel like individuals, especially I think about like community health assessments and implementation strategies. And number one, it's a lot of collecting an extensive amount of data. But there's really no logic. There's really no like end. You really have to think with the end in mind.
Mm.
You can't just go through data. Data is not the problem. It's what you do with the data that matters. Data without purpose is meaningless. Data without action is just noise. And so I feel like you know, there has to be a plan before you're just collecting data, especially when you're collecting it with communities who have been over surveyed and over analyzed. Number one, we already know what the problem is. So why are we asking the same question? We already know what the issues are. So what question can we ask to get the answer that we really need? How can we support each other in asking different questions so we can get what we need to get the support? And so, I've seen it from the other side, and I understand, like, from a grant perspective, I understand, like, I've had to fill out those grants and I've had to account for every dollar for every person and every resource. And so I get it. I get why data matters and why you have to, allocate for that. I understand. But it's just we have to, for people who are creating some of these grants and, requiring some of this data, come on, we got to think better than why are we requiring some of the things we're requiring. We got to think a little bit deeper. Yeah.
That's real in so many ways. And because it's like many people, when you get into public health and you continue doing this work, most of the time what the data is going to say about the same population, and asking, like, to your point, asking the question, is it going to change? You're going to be like, oh, okay, it still exists, and I think we haven't come to a point where we like the outcomes that we see are so predictable in bad ways, and yet we still, to your point, just survey people and ask them about the issues that we already know exist, but we aren't creating enough space to actually talk about how can we actually use data in a meaningful way to drive forward the work that's already there, or how can we use existing data and combine that with actual community voice and input. And like, as you were talking there, and no shade to anyone that works in community health needs assessments, I've worked in many community health needs assessments myself. I think they're very important documents. It's like, after that community health needs assessment is written, how many people in community are reading or interacting with that data in a meaningful way? I think there's a huge opportunity there to share back that data in a way that the community can really resonate and say, wow, this is, I didn't know this about this in my community, and now they might want to show up in a different way or have conversations with their neighbors in a different way. So I say that to say there's a lack there, and there's an opportunity for I think a lot of people that are listening to this to create ways to share more of that data holistically.
Well said.
Thank you. So before you shift to your, like, academic pathway, what does public health mean to you?
I think everything. I was just actually talking to my younger son, and he keeps, so I was wearing my shirt earlier from my college of Arizona, and he was like, that's where you got your doctorate? I was like, no, honey, I'm not a doctor. And so he thinks public health is it just as a doctor, that's it. And so I'm explaining to him, like, public health is this, it prevents all of these things. And he's like, oh, wow. He's like, it's really important. You do a lot of important things. I was like, yeah, we do a lot of important things. And I think, there's so many areas when I was explaining, it's like that we touch. It's just public health is everything. Public health is everywhere. We are all public health. I remember there was I think it was like an APHA or advertisement a while back during National Public Health Week, and it says we are all public health, and I loved that because we are. And I think if we walk with that kind of framework in our mind, and if we all kind of do our part of some sort of prevention or education, we are all public health. And so to me, public health is more about just looking out for your neighbor, looking out for yourself and your health and well-being, and looking out for one another. So that's what it means to me.
Yeah, I appreciate that, and as well as I appreciate that you are sharing what public health is to younger people out there, because I think there's so much value in knowing about public health and having a career in public health, or just a skill set and perspective on the world, and using that public health lens to make an impact wherever that is. And I think that is something that we need to continue to do very broadly. So I appreciate you sharing that. So shifting now to your academic pathway, you got your associate's degree in public health at the Community College of the Air Force. Tell us about that thought process.
Yeah, well, and actually, when I went into the military, my game plan was, so I played basketball and I played sports, and my whole thing was, well, if I don't get a scholarship, my dad was like, well, you can get into the military and you can play basketball. I was like, cool, that's what I'm going to do. And, and when that didn't work out, they were like, well, you need to do some education. And so, I always tell people, when I came into the military, it was very different. I did not choose public health. I always say public health chose me, because it literally did. I came in open general in the Air Force, and they gave me public health. And I was like, what is public health? And they said, you're going to work in the DFAC, which the DFAC is the military kitchen. I was like, I don't know how to cook. Why are you going to put me in the DFAC? I don't want to cook. And so there was a girl next to me, and she was crying and crying, and she got security forces, which was a cop. I was like, oh, I'll change. I'll be a cop. I'd rather be a cop than be whatever this is going to be, public health. And so we tried to change. It didn't work out. So I got stuck with public health. And then I went to public health training school, and it's like a 13-week school. So right after you graduate from basic training, after 6 weeks, it used to be 6 weeks, about 8 weeks now, you go to public health training school. And it's about 13 weeks long. It may have changed. It used to be in San Antonio. Now it's in Ohio, and about 13 weeks long. And the first day I was there, they said, who doesn't, want to be here? And my hand went up. I was like, I want to be here. And they said, we will change your mind by the end of this. So I'm going to come back to you. I was like, okay, good luck. And after my 13 weeks, they came back to me and they were like, so what do you think about public health now? And I was like, I love it. I love it. This is great. Because I got to do everything. Like they teach you everything. I mean, from entomology, go into occupational health. You're doing interviews for communicable diseases. You're doing emergency management. You were touching everything. And it's kind of like an all in-depth kind of hands-on, learning the curriculum, and then before you get to your duty station. And so all of that hands-on. And then I got to my duty station, and I think my mind shifted from, hey, I want to play basketball and this is all I want to do, to I really like this and I really want a career and I really want to go further. And in the military, there's a lot of opportunities for awards. And so the way you rank up and promote is through, it's called the whole person concept. So through your evaluation, it's how you do perform at work. It's how you perform outside of work, volunteering, and it's what you do academically. And it's looking at those different pillars, and then also your fitness and mental or wellness and fitness. And so looking at all those pillars, so I started taking some classes and wanted to go towards my degree. And so that's kind of what shifted me towards that path.
Well, I'm grateful that you weren't able to change, and you had to stick it out,
And once you go in the military, I was the only one that I've stayed. I think I was one of the only ones that stayed.
Well, I love that. I love that for you. So you continued on to get a Bachelor's of Applied Science in Public Health at American Military University. Walk us through that process.
I think I stayed on with just continuing my classes during that time. With just a lot of what I liked about being in the military and doing our courses is we had military our schools right there on base, and so a lot of the time, sometimes if you had enough individuals within your unit, teachers courses would come and teach courses in your office, so you wouldn't have to leave. So to encouraging education, encouraging, continuing development. So which is good because it's good for the career field too, to continue to have that knowledge and that background. And it's good, obviously, for you to have that promotion opportunity. And so, to have, I think it was because of the ease of access, having, the either in my office or right across the street, I had, colleges right there on base. So it was easier to kind of access and get to. Also, military, well, it was, taken care of. So my education was taken care of for me. So I definitely wanted to make sure I utilize that.
Yep, one of big perks for
Oh, yeah.
sure. And while you were, I believe this is while you were in completing your bachelor's, you were a U.S. Air Force first term airman team leader, then operations manager, as well as you were an executive committee member at the Air Force nonprofit agencies for around 8 years. Would you like to share some of the experiences or things that you did in those?
Yeah. Yeah. So a lot of, just different things that you did. So um, like I said, a lot of the whole person concept in your evaluation was just doing different things. And so the nonprofits that they had on base, booster clubs or 5-6, I liked mentoring. And so I had the opportunity to mentor my peers, and I loved creating and having different things. So I would actually set up these, huge, seminars and webinars to educate and get information down to people. And then to educate, different junior enlisted members. And so the FTAC was actually, our first term airmen were those individuals that were new, coming straight from, from basic training. This was our first duty station, and this, brand new to the Air Force. So it was an opportunity to kind of introduce them to everything. So you kind of go through a whole crash course of, this is what to expect. These are your finance department. This is all of the different things on base. So, it's an opportunity to kind of network and to show them around and to kind of just introduce them to life and what those life changes are. I think it's definitely a big culture shock when you come in, especially if you're not used to it. And if you're not, I didn't have anybody in the military. I was the first to come in. So my family was like, why are you doing this? I was like, I want to fly. I want to get out of here. I got to do something different. I never looked back. So I was the only one to go. And so, but a lot of people don't ever leave home. And so it was kind of, it's a little shocking and scary if you're out on your own.
Absolutely. Were there any big takeaways from those experiences that you wanted to share from broadly, like associate's degree, bachelor's?
But from those, what I did get to do that was really unique, because in those experiences, I got to do John Maxwell leadership training. So I actually got certified to do developing the leader within me and developing the leaders within each other's. And so there was different courses that I was trained to facilitate and to teach. And so in that, so I thought that was just a great opportunity to kind of learn and, to get more insight about, leadership and training and skills. And so the military was really good about leadership. And so it was very different than supervision. And so I think those were, even within our bachelor's degree or associate degree, a lot of our credits were still in the leadership, so we went to leadership academies. Those would get credits towards our associate and our bachelor's degree. Those were also accredited, which was good because it showed that we were, training to be at the higher level.
And you worked as a regional infection preventionist
Mm-hmm.
at E238 International. How did you come across that, and what do you do in that role?
Yeah, so I once I decided to get out the military, and I was able to network right back at the facility that I was working at. So every military base has you're always working in a hospital or a clinic. And so I was always part of infection control. Public health is a huge part of infection control. We create the infection control plan. We help run the emergency preparedness plans and exercises and everything. Did bloodborne pathogen programs and TB programs. And so I was already kind of very familiar with that, and there was an opportunity and presented itself, and I was reached out to support that. And in that role, my role was more in line with looking at all of the MTFs on the West Coast. So there's about like 6 different military training facilities, and I had to look at their programs. And so it was more of evaluation and making sure that they were up to, accreditation standards. And this was looking at Joint Commission. So just shifting from ambulatory care to Joint Commission standards, which were more stringent, and ensuring that they were prepared and ready for those new accreditation requirements.
And after this experience, you decided to pursue a Master's of Public Health and Health Services Administration at the University of Arizona. What sparked your interest in wanting to pursue a master's level degree in public health?
I had, I think during that time, it was a struggle because I had gotten out the military and had been out for a little while. I had got out right before I had my son, my last child. And it was a real challenge trying to just decide where I wanted to do. And I think where I struggled was, do I have enough experience? Am I ready? Am I prepared? What is it that I want to go into? Do I have, do I need more, knowledge? And so, having put in for so many different jobs, we were actually getting ready to move. So it's like, I didn't have all the connects anymore. I had turned into from, active duty, always having a job, to a civilian, but being in a connected area where, I knew everybody, to I was about to move all the way across to the East Coast of New Jersey, where I didn't know anyone. I didn't have any connections. I was a military spouse, and I couldn't get a job. I put in for so many different positions. And so I was like, well, maybe I'll go back to school and see if there's opportunities for me after I get a degree, because maybe that's what they're looking for. Maybe I'm not enough. And I think that point in my life was so hard, like a struggle, feeling like I wasn't capable with what I had. But, presenting that way, I think, lessons learned, like looking back now and having some of that confidence, issues, and it just, and kind of like where I struggled and during that time, I think it just learned a lot of lessons about, just transition and how to build that resilience. I think I needed to go to that period of my life and figure out, parts of myself that have changed into who I am now and have helped me grow.
Once again, appreciate the vulnerability, and I think we all have like transitions in our lives, and those times creates a lot of friction in many ways.
Mm-hmm.
I'm glad that you were able to, I guess, persevere through that. While you were doing your Masters of Public Health, you had an internship at the Public Health Accreditation Board, as
Mm-hmm.
well as you were a public health representative at the New Jersey Department of Health. So tell us about those experiences.
Yeah, no, it was a lot of fun. So I came into, my husband it's so funny, like people were so different, and I learned a lot about, I think, men and women. So when I got out the military versus when he got out the military, and I was putting in for like jobs and opportunities, and I'm like, I don't check those boxes. I'm not even going to put in, like, I only check this one and this one. And he would see an opportunity and be like, oh, I'm going to put in. And it would be like one word that he would like or think he meets, and he'd put in for it. And he's like, well, you don't know unless you ask. He goes, I'm going to ask for any opportunity, and I'm going to put in for anything. And I'm like, huh. So it's like, if you change your mindset, and if I go into things like this, and if I change my perspective, then maybe more doors will open up and maybe more opportunities. Well, I tried it and it started to work. I sent a an email. It was Kay Bender, who was the president at the time, Fab, and it's like, I'm looking for an opportunity for my master's degree, and need an internship, and reached back out, and they accepted me to come up there. So I actually got to go in person and do, some strategic planning, and sit in on a board meeting, and be there for their 10-year anniversary. So it was really incredible. It was really great experience, and just learned a lot. And I think it made me love public health even more. And then everybody was so great there. And so I kind of got like a deep dive. And I think just seeing, the nonprofit side, and, the nonprofit world, and different things that they were doing and planning for, was just like, oh, I love this. I want to be a part of this. How can I stay? And so that's when the opportunity to be a site visitor came up. And that's where I took that. And so, I think the lesson there is, you don't know unless you ask. And if you keep second guessing yourself and thinking that you have to check every box, then you don't put yourself out there for an opportunity, then you'll never know.
And that's a real bar there, as people would say. Because I know the data does show that men are more likely to apply to roles than that they aren't fully qualified for, as opposed to a woman wouldn't apply to a role unless she's like 50% or more qualified for the role. And I think to the point of that is like, let them tell you no. Don't put yourself outside of that. Don't close off the door before you even like knock on it, essentially. You were sharing earlier that there was a portion in your life where you had to like overcome confidence. So looking back, let's say there's someone in a similar situation to you. What kind of advice would you give them, or what was the lessons or process that you used to be able to overcome that?
Oh man, I'm always overcoming confidence. I don't think that ever stops. I think when you tell yourself that, I think you stop growing. I think there was a lesson. I was reading the book, and I'm gonna let you know about it. It's Be Water, My Friend. It is by Shannon Lee, who is the daughter of Bruce Lee, and she talks about the philosophy of his teachings. Be water, my friend. So he never wanted to put anything in a book. He was a martial artist, and mastered, and really, really changed the art and brought it in that culture to so many different people, and really transformed many different things. And so, but never wanted to. He wrote and put different things in books, but never called it finished. And he said he always wanted to leave it open because he was never done growing. Nothing was ever finished. He always wanted to learn more, and he was never fully grown. He was never fully done. And I think he said, when you call yourself a master of something, then that means that you've closed that chapter, and you've closed that book to say, well, I've mastered it, and I don't need to know anything else. And so I think that's how I've, taken, my life, and things that I'm learning now, is that I'm leaving the door open to, yes, I still struggle with confidence here and there. I got a huge speech coming up, and I'm like, oh, I don't know. I'm gonna be able to do this. Am I ready for this? And what's good to come for it after? Am I ready for success after? Am I ready for failure? Or am I ready for, what is going to happen? And so I think you take one step at a time. And I think you give yourself some grace, and you count your wins, and you give yourself a pat on the back. And you learn from the things, you need to learn from. And I think you keep moving forward,
Yeah, understanding that it is a process, and like again appreciating that like you're just sharing like it's something that you still are working on to this day,
Mhm.
and like it always is going to be there. And I think it's how do we develop the skills to like deal with it in a way that isn't traumatic or harmful, but allows us to try to operate at our best in that specific situation.
Yep.
So you graduated from your Master's of Public Health program and you shifted into a role as a medical mobile clinic outreach coordinator at St. Joseph's Children's Hospital in Tampa. How do you come across that, and what do you do in that role?
So that's been a while ago. I know when you talk about, it, it's like you graduated, and I'm like, God, that feels like so long ago. I haven't been in school forever. I'm actually doing certification program. I'm like, oh man, I don't even want to open a book. I, thinking about learning and going back to do that type of process all over again. It's pretty rough. But we decided. I think we're so used to just like moving and going. Didn't have any family in Tampa. We're just kind of like, where can we get more bang for our buck? Where aren't we going to get taxed too much? Where is the low cost of living? Okay, pick these states. Perfect. Tampa. We came down here one weekend and was like, oh yeah, this is nice. All right, let's go. And my husband was retiring and we moved down here, and it's like, well, I need a job. So what am I going to do? And this is where strategy came into play. So I remember how I said I was leaving when I was turned into a military spouse, and I was leaving my connections and my built stability, and I was coming all the way to New Jersey and where I didn't know anybody. And that led me into a crisis. Pretty much I lost my confidence. I was struggling. I didn't know what to do. I felt like I wasn't good enough. So knowing that we were going to leave and knowing when we were going to leave, I strategized because I didn't like that feeling and I didn't want to feel like that again. And so what I did this time was, okay, I have a few months to get this together. What am I going to do? How am I going to prepare? I found a mentor. I joined a network. I had connections in Tampa before I even landed here. I had interviews before I even got here. I was on the road, had to stop to do an interview. By the time I got here, I was in person doing interviews and was already my second interviews. And by like week 2, I was already at networking events, meeting people. And one thing I learned at one of the networking events, second week here, was it's all about who you know. They don't let anybody in the door unless you know somebody. So where do you want to work? And I'll introduce you. And was like, perfect. And so it's how things started to work. It's where I strategized and figured out, okay, how did things work? And so that networking opportunity in getting myself out there, because I didn't want that was the resilience, right? That was that missing piece that I didn't have when I moved the first time. So having that, I had better stability. I felt good about myself. I felt like I can do this, and was able to jump into a job within a few months. And started in the mobile clinic, which I absolutely loved. I was there until COVID. Unfortunately, had to shift because my little one was in kindergarten, and I was getting calls from the teacher when he had started kindergarten because he was under the desk learning instead of on the computer screen when he was supposed to be. And so I had to come home. I had to come home and be here to support him. And my other daughter, who was here also. My husband was struggling, trying to figure out how to do this all by himself. And so I'd left the mobile clinic, but I absolutely love that work. I think if you have a chance to, it's so intricate world. I went to the mobile clinic associations, and got into that space and how the mobile clinic works and how we purchased new units. And it's also very different from like an infection control perspective, and looking at how we inspect and evaluated and ensured our medications are up to date, and things like that, and cleanliness and procedures. So it was very, very, very different from that lens. But what I loved the most was the social service that we were able to provide. We got to do a lot more than just, the basic care, we got to provide connections to different community resources. And that's when I knew, like, okay, this is where I need to stay. But there was a bigger need. And I think from that moment, I realized, I need to do more, and there's more areas where I can work, I think, with my knowledge, my skills. And as I was trying to push and change, but it's like, you need to talk to the right people. And so who are the right people to make that change happen? And so that's what started kind of a strategic move to talk to the right people.
Love that. And I think you offered great strategy as well as some tactics for people to think about as they're navigating maybe some like transitions in their career. So appreciate you raising that up. And if you didn't catch that, rewind a bit and then take some notes. After that role, you were an account manager at Unite US. Unite Us. Okay,
Yeah.
that's what I thought. Okay, account manager at Unite Us. How do you come across that? What do you do in that role?
Yeah, well, I had to pivot quickly to come home. And so I needed something that was work from home. It was my first time having to work at home. And came across a veteran-owned organization, was like, oh, this is pretty cool. And it was along the lines of, dealing with social determinants of health. I was like, yes, this is my area. And so, came across that, went through the interviews and, enjoyed the work that we did. And it was more, in perspective, but looking at from like a platform perspective, but utilizing the platform to connect people and making sure that it's in the hands of healthcare systems as well as community organizations, and that they are working together to connect people to those resources and following up on those loops so that they're closing the loop versus leaving those loops open and leaving those people without those services. And so that's what I enjoyed, about that work that they were doing. And so I thought that was neat, intricate. And I think what it taught me more about was the data perspective and dashboards and understanding kind of how that social network and where they were going in that space, because it's a huge space now when you think about like AI and where we're moving to and how integration is happening in healthcare. It's very in the forefront and what's happening.
Absolutely.
Yeah.
And you're also were, I think, mentorship program chair at Sisters in Public Health.
Yeah.
So huge fan of Sisters in Public Health. Everybody I should imagine they know that, but in case they don't, saying it publicly out here. So tell me, how do you get connected in that, and what did you do as mentorship program chair?
Yeah, unfortunately, I didn't get to stay with them long. I overbooked myself on so many different levels, and I had to kind of back out of that. This is where I asked for help and had to say, I'm sorry, I had to throw in the towel on that one. I just got overwhelmed, but I get the great organization. I had been following them for years. I think since I was in my degree or getting my degree, and loved the work that they were doing, loved what they were being able to provide, some of that mentorship and that guidance, and actually went to a couple of the networking events here in Tampa. And so I knew a lot of the individuals and was, supporting some of that work out here. So I, during the mentorship role, it was the second time that they were doing this. And so they had a lot of individuals that were looking to get mentoring from other, individuals in public health who had been in public health for a long time. So we just kind of had gotten started before I had needed to go. But it was more of just connecting, early career field professionals to individuals who had been in public health, and more aligning those individuals for a mentorship time, and then creating what that mentorship looked like, what those goals were and for how long, what the strategy was.
Well, once again, really, really do appreciate your vulnerability and like sharing, like, because I think like to that perspective is it's just so important to let people know, sometimes we think we have more capacity than we actually do. Then we actually get into something and we realize that it is too much. And I think it's important that we have that self-awareness, going back to that, to say, I've taken on too much. Let me not do this to myself, because then my family is going to suffer. I'm going to suffer. All the other things are just going to ripple. So I appreciate you just being self-aware and vulnerable to share that, because that's something I think we don't talk about enough in just life. And I've done many a things where I pushed too far, and then I've had to come back, or like a kind of, I guess, to burnt out or whatever the case might be. So appreciate you sharing that.
Yeah.
And yeah, thank you for the work that you were able to do there as well.
Yeah, thank you.
And then you have a few roles that you're in currently. It seemed after this, or throughout this period, you shifted to doing a lot more consulting type work. So I will name the roles that you currently are a part of. You're a public health consultant at Conduit Healthy Communities Institute. You're a partner and collaborator at We Public Health LLC. Shout out to Jennifer. You're a co-founder at the Culture Marauders LLC, and you are co-founder at CEO at C.R.E.I.D LLC.
Yeah.
So tell us about that journey into consulting and then into doing the work that you do.
Yeah, no, definitely. I think I got to a place, that, I knew so much information, and especially getting so much information in public health, that I wanted to be able to share. And I also can think strategically, because it's like I could see where there's maybe some missing gaps, and I wanted to convene and put people in the right spaces and move them where they needed to go. And so I think consulting was the role that I could, put into it, and be able to do that. And so, going into Conduit and being able to talk to the right people. Remember, I told you about, I wanted to ensure that I could get the message to those individuals who could implement change and could have the right data so that they could make those decisions. And those are the individuals that I wanted to be able to present that to, and, be able to consult with. And so that's reason why I wanted to do that. And I love community health. I love being able to talk to community members. And what I like to do is be able to tell their story, is what I say, is be able to convey their story through data, and present it in a way that people can understand, to create action, and implement. And, in joining, or, We Public Health, that was more within the last year or so. And, Jennifer's great. I'm working with her in a couple of projects. And I came across, I had joined a couple there's other women's organizations, and I enjoyed how, women were supporting each other through mentorship and guidance. And so I wanted to learn more about consulting, and starting my own consulting business, and what that kind of looked like. But I needed some support, and I also wanted to see what other people were doing, and, how to niche, and how to, work through some of the things that were difficult in doing as far as business. And so joining a network of people who are all in there together, so I didn't ever feel alone. So I think was great, because you don't ever feel alone. You're always in there with individuals who are, we're going through learning either, new tools or resources. We're sharing things, also collaborating on projects, which is amazing. So if you don't have the staffing, and the resources yet, you can partner with other people and get those opportunities, and experiences, which I think is great. So it's a wonderful, wonderful opportunity to take advantage of. And then also networking, it's great. And then, women supporting women. So I think that's wonderful. And then Culture Marauders, we started when we got here to Tampa. It was a way, we didn't know anybody. We started out just podcasting, and it was actually my husband's way of his transition, being connected to music and media, and, being military, we were always connected to different cultures and different people. And it was like, we need to get out. We need to meet people. We don't know anyone. And then COVID hit and it was like, well, shit, we can't even talk to anybody. So we can't even go out. So we were connecting with people and we're doing podcasts. And then all of a sudden that morphed into something else. It's like, as a business owner, it just shifted. So we were doing podcasts of our own. And then all of a sudden people were like, can you teach me how to do a podcast? Can you just do trainings on podcasts? So now it's Culture Marauders has actually shifted and are working on putting that out. But it is, and my husband runs that business solely because it has grown. But we do podcast production. So people come on and they just want to be able to get on and talk and do their own podcasts or either learn how to do a podcast. And so they get the training that they need, or they come on and they speak. We create the virtual studios and we have an editing team that goes behind the scenes and does the magic for them and releases the show, and they can have, promote it and things like that for them. So, way for them to market. And it's also a way, we kept the Culture Marauders more in the line with getting to know other cultures through entertainment and music. So again, with my husband's kind of background in music as a DJ and in, doing with the, like I said, podcasting and hosting different events. I do facilitation, things like that as well. And so we curate events through Culture Marauders. It's more of an entertainment and curating event platform. So we've shifted over the years. I think you start a business, you want it one way, and then it grows into something else, but it's wonderful. It's taken off on its own. And then C.R.E.I.D started because it was my passion in the community health and wellness space. Because of my background in resilience, I was doing, teaching resilience when I was in the military, and then, me struggling with my own resilience and, transition out of the military, and how I struggled in just being able to, the culture shock from military way of thinking and way of doing things to the civilian culture, and lack of transparency and lack of opportunities, things like that. And just having that shift and that balance, it was very, very, very difficult. And then having a newborn and, just all the different things that I experienced in going through those changes. So really relying on the resilience. I went through a whole holistic wellness phase and really, mindfulness and meditation, and really found some power and some stability in that. And so encompassing that with my community health background, I started C.R.E.I.D, which is consulting and coaching. So I'm also doing, coaching. And what I like to do with coaching, and I say transformation coaching, is I like to work with, those in social impact, those people who are working in trying to make a change and helping them put their mask on first, is what I say. Is because sometimes we don't take care of ourselves, and how can we take care of everything else and put out the fires if we're not putting on our mask first? And I've been there, done that. And so that's what I'm trying to do with, within C.R.E.I.D, as well as, still working in community and, working in equity and inclusion space.
Love it. I love this, like the idea or the story behind like the Culture Marauders starting off as like a way for you all to like connect, make community, and then through that, it's like the business kind of side of you and your husband kind of sparked like, oh, there's an opportunity here to do that and do other things.
Mm-hmm.
What maybe is something you wish you knew before starting all these consulting ventures?
Oh man, put a lot of money into business. I think there's a lot of, I think knowing what your plan is, I think that was, we put a business plan out. It wasn't very detailed. It was just here. And then we just kind of jumped into it. So not having something clear, but then also we didn't really plan for the change that could have happened. And granted, you don't really know, but just what it could become or what just kind of forecasting. And so with that, when you're in the middle of changing, you're putting a lot of money into your businesses, in changing either websites or marketing and things like that. And so I think learning now, I would have done a better strategy plan, and forecasting some things ahead of time. But I mean, I think we live and learn. I think, things turned and shifted the way they needed to. And I feel, our businesses grew the way they needed to grow because we grew and changed. And I think we changed in totally different ways than I thought I was going to change. So for sure.
And what do you enjoy most about being the CEO of C.R.E.I.D?
That I get to network and work with people from all over different spaces. I think I get people that connect with me because they find something that stands out to them within, the work that I do, or even in the word. I had someone that said, it was the wording about equity and inclusion and how individuals are, we're being told not to say this, but you are still not afraid. And I'm like, oh no, I'm not afraid of anything. So bring it on.
Love it. Love it. As we shouldn't be. It is a time like this too where we have to stand up for the things that are important. Okay, so before I move you on to the Furious Five, the 5 questions that I ask all guests, there's a section that I added in, and I didn't put this question in the doc before, so apologies for that. But this is a question that one of the past guests of the podcast asked the future guest. So the question is, what is a misconception people have about working in public health?
Maybe that it's all only just data. I think we do a lot more than just, I think data does drive a lot of what we do, but I think that it's bigger than that. There's a lot of focus on, the prevention side and education side of things. But I do hear a lot of people say kind of it's just you're focused in on data and you don't really change and you don't do anything other than what the data tells you to. And so I think that can be a misconception, is that we are flexible and adjust, and we do. I think there's different kinds of data that we incorporate between the secondary data and also the qualitative, so that now what people are saying, the focus groups, the informant interviews that drive where we move and how we move.
Appreciate you answering that on the spot. Okay. Now moving on to the Furious Five, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
I think just follow your heart and your passion. I think I love public health. I think you're doing the right thing. I think if you have the goal to wanting to help people and support others, I think this is a perfect field, and you want to do something that's bigger than yourself. It is grounded in hard work and labor, and it's a labor of love. I think that's what public health is. But I think it's very rewarding field.
Number 2, if you are talking to someone wanting to get into your position, what advice would you give them?
Networking. Biggest thing I have learned is how to move around the room, is what I call it. It's dancing, move around the room. So it's getting into a room and not being afraid to walk and get to know people, putting yourself in positions that may be a little awkward or a little scared, but introducing yourself and networking and, before you get somewhere, and maybe in spaces that you haven't been in before.
Number 3, what's something you are working on improving in your life right now?
Working on improving? I think right now working on communication, improving that a little bit better. And it's more of like when to communicate and how, because different individuals receive communication very differently. And so because I've worked on project being in consulting, especially when you work on things by yourself for so long, communication, and working as a partnership and collaborating can sometimes, be very different when you start including other people. So it's just being mindful, I think, of communication and how you come across, something that I'm working on improving.
Number 4, professionally, do you recommend anything?
Professionally, always leave the door open to continue learning. I think, learning more about yourself, first and foremost, and then also learning about others, keeping the door open to learn, even from people that are different from you, with different opinions than you, different perspectives. I think those are the best people to learn from. Is just to be open. Doesn't mean that you have to agree, but just to be open to different perspectives.
Number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
I would say be fearless, but I think, coming into the military was pretty fearless. Um, uh, hmm, I don't know. I definitely wouldn't have changed anything. Take a couple more risks, maybe.
Yeah, that's absolutely fair. Well, Corinna, thank you so much for coming on today, sharing your story, your expertise. I enjoyed it a lot, and I think, I don't think, I know a lot of other people are going to get some value from this conversation as well. So once again, thank you so much.
Yeah, thank you. Thank you for having me.
It is my pleasure. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet, and leave a like if you're on YouTube. Leave a 5-star review on all podcast platforms and share it with a friend. Really helps the show get out to more people. Deeply appreciate you all. Have a great rest of your week, everyone. Peace.
Bye.